Question 47. An 85-year-old man with a history of Hashimoto's thyroiditis, who is being treated with thyroxine, complains of a hoarse voice persisting for the past month and a weight loss of 10 kilograms over the last 4 months. Upon examination, he has swelling on one side of his thyroid gland. Further evaluation by a head and neck surgeon reveals right recurrent laryngeal nerve palsy. What is the likely diagnosis? Option A, thyroglossal cyst. Option B, single thyroid nodule. Option C, medullary thyroid carcinoma. Option D, anaplastic thyroid carcinoma. Given the patient's details, the most likely diagnosis is Option D, anaplastic thyroid carcinoma. Anaplastic thyroid carcinoma is a highly aggressive and rapidly growing thyroid cancer. It often presents with hoarseness due to recurrent laryngeal nerve involvement, as well as rapid weight loss and a rapidly enlarging thyroid mass. It tends to occur in older individuals. A thyroglossal cyst is a congenital anomaly that usually presents as a painless midline neck mass. Single thyroid nodule might be a consideration in an elderly individual. It typically doesn't cause unilateral thyroid swelling or recurrent laryngeal nerve palsy. Medullary thyroid carcinoma is a type of thyroid cancer that can be associated with hoarseness and neck masses. However, it is less likely to be rapidly progressive and associated with significant weight loss. Question 48. A patient arrives at the emergency room with a 24-hour history of vomiting due to food poisoning. The patient reports having noticed 2 episodes of fresh blood in their vomit. Under what circumstances might a nasogastric tube reveal occult blood? What is the probable diagnosis? Option A, gastritis. Option B, Dieulafoy lesion. Option C, peptic ulcer. Option D, Mallory-Weiss syndrome. Occult blood in the nasogastric tube is more likely to be observed when a patient has continuous, slow bleeding from a source in the upper gastrointestinal tract that mixes with stomach contents. In this scenario, the most likely diagnosis is Option C, peptic ulcer. Other options such as gastritis, Dieulafoy lesion, and Mallory-Weiss syndrome can also lead to bleeding. But the specific description of blood appearing in the vomit and the presence of occult blood in the NGT make peptic ulcer a more fitting choice in this context. Question 49. A child is brought to the hospital by their parents due to an arm injury that has led to the inability to move the arm. X-rays reveal fractures in both the distal ulnar and radial bones. The child appears healthy, well-dressed, and maintains good hygiene. The parents recall an incident where the mother accidentally dropped a plate on the child's arm 2 days prior. However, over the course of 2 days, the child's arm mobility deteriorated. No noticeable bruising is observed, and the parents believed it to be a strain. Which aspect among the following options could potentially indicate child abuse? Option A, type of fracture. Option B, delayed presentation. Option C, consistent story of the parents. Option D, the appearance of the baby. In this scenario, the delayed presentation of the child for medical care despite a significant arm injury, coupled with the deterioration in arm mobility over the 2-day period, raises suspicion for child abuse. The lack of noticeable bruising and the parent's explanation for the injury may not align with the severity of the fractures observed. Child abuse should be considered when there is an inconsistency between the history provided and the clinical findings, especially if the timeline, mechanism of injury, or presentation is not consistent with the observed injuries. Question 50. A 55-year-old man has been referred for further assessment of the intentional tremors he is experiencing. Which physical examination finding would provide support for the diagnosis of alcohol-related tremor? Option A, inability to speak coherently. Option B, increased muscle tone. Option C, walking with a narrow-based gait. Option D, difficulty with rapid alternating movements. When assessing for alcohol-related tremors, one characteristic finding is a narrow-based gait, also known as narrow steps gait. This gait abnormality is often seen in individuals with chronic alcohol use disorder, and is associated with cerebellar dysfunction due to alcohol's effects on the cerebellum. The person may exhibit unsteady and hesitant steps, taking shorter strides and potentially swaying or stumbling while walking. The other options listed do not directly correlate with alcohol-related tremors. Question 51. You receive a call from another physician who is currently treating a former female patient of yours. The patient has recently moved to a different city, and you had referred her to this physician. The purpose of the call is to request immunization records for the patient's upcoming overseas trip. However, you realize that the patient had not previously given formal authorization for the release of her medical information. What is the most suitable step to take in this situation? Option A. Send the patient's immunization records to her new physician without her formal consent. Option B. Consults the ethics committee of the state medical board about the appropriate course of action. Option C. Have the patient sign a consent form allowing the release of her medical information to her new physician. Option D. Refuses to send the patient's immunization. The most appropriate course of action in this situation would be Option C. Have the patient sign a consent form allowing the release of her medical information to her new physician. Medical information is sensitive and private. Sharing a patient's medical records without their explicit consent could potentially violate their privacy rights. Even though you referred the patient to the new physician, you should still obtain formal consent from the patient before releasing any medical information, including immunization records. This demonstrates respect for the patient's privacy and ensures that you are acting in accordance with medical ethics and legal requirements regarding patient information. Options A and D involve either releasing the information without consent or refusing to send the information, both of which could lead to ethical and legal concerns. Question 52. A 55-year-old individual is involved in a motor vehicle accident and experiences blunt abdominal trauma. The patient's blood pressure is 90 by 63 millimeters of mercury, and the heart rate is 104 beats per minute. Despite attempts to administer fluids, there is no improvement in the patient's fluid responsiveness. A fast, focused assessment with sonography for trauma examination does not show any fluid in the pericardium, chest, or abdomen. What would be the most appropriate next step in management? Option A. Perform a laparotomy. Option B. Conduct a CT scan. Option C. Proceed with diagnostic peritoneal lavage. Option D. Repeat the fast examination. The next best step in managing the patient's condition would be Option A. Laparotomy. With a negative FAST indicating no fluid in the pericardium, chest, or abdomen, and considering the patient's condition, a laparotomy is warranted to assess for and address potential intra-abdominal injuries that could be causing the hypotension. This surgical approach allows for direct visualization of any injuries and immediate intervention.